I think that the other thing that's really important to understand, you just mentioned the 600 students at Cornell. It is really important to understand this is a new virus, and because it's a new virus and we don't have baseline immunity, it spreads more quickly. And, you know, there have been some really frightening reports about the bad outcomes associated with this. And it is critical that we keep using the good hand hygiene and the good respiratory hygiene. And most important, if you're sick, stay at home. Stay at home for that critical period of time where you have the fever and 24 hours after your fever goes away.
Is it that people don't even know that what they're feeling is a flu-like symptom? Because, you know, it could start off as just an ordinary viral infection. It could be a cold, it could be a sinus infection.
Right.
It could be any of those things before it morphs into more serious flu-like symptoms.
Absolutely, and I think that what is confusing is that for most people, all it feels like is a bad cold.
Okay.
Unfortunately, for some people, particularly people who are in that high-risk group, pregnant women, people who have underlying medical conditions like heart disease and lung disease, asthma, for example, kidney disease, diabetes, for them it could be fatal, and so it's really important for us to protect the people who are vulnerable by doing the right thing, and that's what's difficult, because for most people it isn't that bad, but we need to protect those people for whom it would be bad.
So we just learned today, the health department said that it's going to be slow rollout for this vaccine. So ethically, how do you decide who's going to get it and in what stage they're going to get it? Is that a tough decision to make? Well,
in some ways it is. In others it's actually very easy, because there's something called the Advisory Committee on Immunization Practices that has the best scientists and advisors in the country and some in the world who make the decisions. They have a lot of input. They know the science. They know the vaccine. And they give us the guidelines. So, for example, right now there's a target population if we have a lot of vaccine, and we expect to get a lot of vaccine, just not all that first day. Right. So in that larger target population, pregnant women, healthcare workers.
Pregnant women first, are they the most vulnerable?
It's not really strategized that way, but the priorities are pregnant women and healthcare workers are probably right up there. Families and daycare providers of children who are less than 6 months old, because children who are less than 6 months old can't get the vaccine. It's not licensed for children that young. So we need to protect them by vaccinating everybody around them. Children who are 6 months to 24 years of age, that includes the college population, sorry, young adults who are up to 24 years of age, and then adults up to 64 years of age who have underlying medical conditions that we talked about. Now, in the beginning, when we have limited vaccine, we're going to narrow that even further. Pregnant women, healthcare workers, families and daycare providers of children less than 6 months old, children 6 months to 4 years old, and then children between 4 and 18 who have medical problems.
The governor, this is going to be covered by your insurance or not?
Well, all of the vaccine is federally funded vaccine. So there shouldn't be cost to the vaccine, but physician offices can and should cover some of their costs associated with the vaccine through an administration cost, and the insurance companies must cover that administrative fee.
Will there be, for example, this is Onondaga County we're talking about, but what happens in some of the other counties? We're in 19. Are the similar protocols being followed in the neighboring counties, for example? Yes,
we try to organize so that across the state we have a consistent approach. And of course there's going to be a little bit of variability from county to county, but we really are trying to make a single message so that it's easier.
I wanted to know, for example, if you are at a Y or any of these public places where people are using stuff and you don't know, is it really, really important if you're at a working out in all these public places to wipe down that equipment before? Is it spread that way?
If someone sneezed while they were working out and then put their hands on the handlebar and then someone else came, it could be a mode of transmission. The most important way that this is passed from person to person, if I have it, when I cough, speak, sneeze, little microscopic droplets go out in the air, and then people within a 3 to 6 foot radius of me, so we're sitting close enough.
3 to 6 feet?
Yes, can then breathe in those droplets.
This is why this is spreading like, so why are people dying because of this? Is it because once they're diagnosed, we don't get to them soon enough?
Certainly, early diagnosis, for the medication to be effective, it really needs to be given within the first 48 hours. Unfortunately, a lot of people don't really feel that sick for the first 48 hours. But we don't really know why in some people it becomes so bad, where their lungs shut down and they just can't get oxygen to their tissues. We don't really understand why that is in some people and not in others. But the good news is that for most of us, if we get it, 2 of my children probably had it. I didn't have them tested because they're healthy children, but for them it was a bad cold. And unfortunately for some of us who are more vulnerable, it turns into something much worse. And why that exactly happens in one person and not another, we just don't understand that yet.
Quickly, how should businesses treat this if an employee has the symptoms? Other business entities or daycares, we talked about daycare, and people at home, how should it be treated? Let's start with the workplace.
Well, in terms of the workplace, there are a couple of important things. Make sure you have access to good hand hygiene. So if your workplace doesn't have sinks and soap, make sure the workplace provides this.
Okay.
Make sure that the workplace has a supportive sick leave policy. What I don't want to see, what none of us in the healthcare profession want to see, is a requirement that you have a note to go back to work. Because that means that you have to go see your doctor, and your doctor is going to be overwhelmed by other sick people. If you're mildly ill, stay at home, and the work leave policy should be that if you have influenza-like illness, you do not need a note to return. Same for schools, because that's going to clog up our emergency rooms, our prompt cares, and our doctor's offices.
And before we had schools shutting down and scrubbing everything, that's not going to happen this time.
No, and what we found out, that the social disruption had a cost associated with it. It was hard on the parents. Some children were left unattended, not here, but across the country.
All right. Well, we thank you, Dr. Cynthia Morrow, and we should tell you that the Onondaga County Health Department has a website. It's at ongov.net, or you can call them if you want more information, 435-3280. You can also call the New York State Department of Health 24-hour H1N1 hotline, or what's the name of that?
Novel H1N1.
1-800-808-1987. And on your website, I should point out that on the County Health Department website, there's all these different ways that your business, healthcare, et cetera, can put in the right precautions to make sure that your staff and your team is safe. Thank you, Dr. Morrow.
Thank you.
All right, speaking of staying healthy, I thought this was interesting, so I'm passing it along to you. I'm always wondering about what weird chemicals are found in toys and backpacks and other stuff my family uses every day. So if you're interested in the same thing, there's a new website that details all the chemicals in over 5,000 common household items. It's called healthystuff.org. All right, check it out. Just ahead, what college campuses are doing to prevent H1N1. You're watching CI.